Liver. Liver is a large, solid gland situated in the right upper quadrant of the abdominal cavity. It is brown in color, soft in consistency, and very friable. It weighs about 1,600 grams in male and about 1,300 grams in females. Location. Liver occupies the whole right hypochondrium, the most part of the epigastrium, and the left hypochondrium up to the left lateral line. External features. It is wedge-shaped and resembles a four-sided pyramid. Surfaces. There are mainly two surfaces of liver. One is the diaphragmatic surface. In the diaphragmatic surface, there are superior surface, anterior surface, right lateral surface, and the posterior surface, and the one visceral surface. In visceral surface, there is a inferior surface, and there is a inferior prominent border. It shows a cystic notch and a interlobar notch. Cystic notch for the fossa for the gallbladder, and the interlobar notch is for the falciform ligament. The prominent border separates anterior border and the inferior border from the anteriorly, and in the lateral side it is rounded where it separates the right lateral border from the inferior border. Lobes of the liver. Liver is divided into the right lobe and the left lobe by the attachment of the falciform ligament. The left lobe is much smaller than the right lobe. The right lobe is occupying the 5/6 area of the liver, where it is include the caudate lobe and the quadrate lobe. Caudate lobe is situated in the posterior surface of the diaphragmatic surface of the liver, where it lies superiorly to the porta hepatis, between the inferior vena cava and the ligamentum venosum groove. It lies between the ligamentum venosum and the inferior vena cava. Okay. Then the quadrate lobe. Quadrate lobe is situated on the inferiorly to the porta hepatis, where it lies between the fossa for the gallbladder and the ligamentum teres. Porta hepatis is the deep, shallow of about the 5 centimeter deep, 5 centimeter long, situated in the inferior surface of liver. Relations of the liver. There are mainly two relations of the liver, which includes peritoneal relations and the visceral relations. Peritoneal relations are as follows. The bare area of the liver. Most of the liver is covered by the peritoneum, but the small bare area, it is devoid of the peritoneum. So it includes the bare area of liver, the groove for the inferior vena cava, the groove for the fossa for the gallbladder, and the attachment of the lesser omentum, which is called the tuber omental. Now we will see about the visceral relations. Visceral relations of the superior surface. Superior surface is concave from the middle, which shows the cardiac impression, and it's convex from the side to side. That helps it to fit in the diaphragm. Now we will see the anterior surface. Anterior surface is triangular and slightly convex, where it is related with the xiphoid process of the sternum from the above, and a xiphoid process of the sternum and the anterior abdominal wall. The posterior surface is triangular and the middle part shows a deep concavity for the vertebral column. Its relations are as follows: the esophageal impression, the impression for the tubal lesser omentum, that is called as tuber omental, the caudate lobe, the inferior vena cava, and the ligamentum venosum. The inferior surface shows gastric impression, and it has the quadrate lobe. It shows the pyloric impression, duodenal impression, right renal impression, and right suprarenal impression. Then we have the right lateral border. Right lateral border is quadrilateral in shape, and it is related with the 7th to the 11th rib. The diaphragm separates it from the lungs, from the pleura to the 10th rib, and from the lungs to the 8th rib. Arterial supply. The liver receives 20% of its blood from the hepatic artery, and the 80% of its blood from the portal vein. Then the venous drainage. Venous drainage has the hepatic veins. There are two groups of hepatic veins, एक superior and then inferior. Superior has right hepatic vein, middle hepatic vein, and the left hepatic vein. And the lower group has a small veins from the right lobe. Okay. In the infrasternal angle, the liver is readily accessible to the examination on the percussion. It is not palpable normally due to the normal tone of the recti muscles and the softness of the liver. Inflammation of liver is referred as the hepatitis. For example, malnutrition, the liver tissue undergoes the fibrosis and it usually shrinks. And this is called the cirrhosis of the liver.